It is my pleasure to invite Ms. Sangita Reddy to please deliver the welcome address.
Namaste. Namaste and a very, very, very good morning to all of you. How wonderful it is to be here, to see you, and most importantly, to feel the energy that everyone in this room is a healthcare evangelist who's made a difference and is ready to make a greater difference. My greatest pleasure is to welcome you here this morning for the 5th International Patient Safety Congress. Thank you all so much for being here. Many of you have traveled great distances to join us. You bring to this forum your knowledge, your capability, your passion, your interest, your experience, and a greater, safer, brighter future for all patients. And we welcome you physically, but also emotionally, spiritually, the spirit of cooperation that brings you in here, and the commitment and the passion to see a better world. You're also visiting a country, or all of you who are from India and those who are not, you're seeing a country who is in the midst of a tremendous transformation. I returned to India when I was 8 years old as a child, when my father, as you know, Dr. Reddy, who sends very good wishes to each and every one of you, but he came back and said, Indians deserve the best in healthcare, let us find a way to do it. Not only has the healthcare scenario evolved over the last 30 years, but we have seen the telescoping of advances in the Western world being brought into the country so that today we can stand head to head, shoulder to shoulder, intellectually and emotionally on the same platforms to say that yes, we are one, we are united, we are capable, and we will give our country a tremendous future. Our leadership in Delhi has been energized. As all of you know, our Prime Minister Modi has not just unveiled a series of important initiatives from Swasth India, which means a healthy India, to a cleaner India. Its focus on the basics of sanitation and goes all the way up the spectrum to digital India. And the combination of these initiatives, the energy and the dynamism of the team, but most importantly, the resurgence of the youth power in this country will create a combination which I believe will see India in the next 5 to 10 years transform itself. And in the midst of that transformation is a very important role for healthcare. So as I welcome 1,500 delegates from over 20 countries, over 150 thought leaders who will be speaking at the conference, but every single one of you here are thought leaders in your own right. 9 streams, 4 plenaries, 1 joint plenary session, 140 papers from different organizations, 120 entries for the Patient Safety Congress Awards from 43 different hospitals across 20 countries. The most important theme, which is educate, spread this knowledge, engage, be completely committed, and finally to empower. And I think across the healthcare spectrum, there is a tremendous need to empower the various levels who are working on the hospital side, but also to empower the patient and the family members. The aspect of safety, the fact that 10% of hospital patients are at risk or have some kind of a safety event, the statistics about hospital-acquired infections, or the 20 to 40% of healthcare spend which is wasted because of inappropriate care, procedures, or lack of safety. I do not need to share more details of these with you. You are truly the experts in this field. But what do we need to do today? What are we all here to do together? We're here really to help unify the healthcare ecosystem across the continuum of care, whether it's the movement of a patient from home to clinic to hospital, from a primary healthcare center to a district hospital to a referring hospital or a tertiary, and then all the way back when the patient goes home. We're here to find ways to draw this communication and connection into the patient's families across as we see the continuing. Last year was the first time that the healthcare balance tilted, and the impact of non-communicable disease outweighed the impact of communicable disease in India. This tremendous tsunami, which is upon us, needs a different kind of care empowerment, a different kind of care continuum, and a different level of focus on prevention. And we need to do this while at the same time solving our everyday problems, because as you all know, unfortunately in India, 2 Boeing jets of babies, of small children, die every day simply because we haven't handled their diarrhea properly. So we're sitting on 2 different levels of problems at the very same time, and we need a new level of energy. We have to identify the challenges appropriately, and the national safety goals, the work of NABH has demystified quality, identified the problems related to safety, put them into safety goals, procedures, and guidelines. Today is about sharing, spreading, empowering, and swapping your stories, your success stories, so that the journey becomes easier. Today is also about asking and demanding hospitals to spare no effort in implementing these goals, to promote transparency, and most importantly, to also use the new technology. As we sit in Bangalore, which is India's high-tech city, can we tell medical technology people, give us software which is friendly and easy to use, connect our nurses with their mobile phone at the same time that you're connecting them with the ICUs, let the devices which are gathering information be communicated into our safety deciphering so that we understand the value of those numbers and can translate them into actionable items of care. There's a whole information highway of caring and patient safety that we must help develop together. So in the other hall, you also have transforming healthcare through IT. Please use the advantage of this, at least over the lunches and dinners that we have together, to share ideas and thoughts and propel our country and the world into a safer, healthy environment. There is much to be done, but there are great brains and great capability to do it. So I remain extremely, extremely positive that every day we go one step towards a safer healthcare environment. I want to end by once again welcoming all of you, but also at the very beginning giving one word of acknowledgement to our tremendous team, and I'd request the audience to really acknowledge them, the leaders of quality, the organizers of the conference, our quality team, everybody who's put together the thoughts, the workbooks, the coordination to make this program a success. So as I welcome all of you, I'd also like to congratulate our organizing committee and all the teams for the great work that you do. Keep up the spirit. I know you have sponsors who support you, but I think the real propelling factor is coming from within. And finally, I want to end with a small story. This is a war that we're fighting, and once there was a general who was going into battle. And as this general went into battle, he had a very small team. But it was a powerful, empowered team, committed team, dynamic team. But on the other side was a huge force. And this empowered team said, General, can we do this? And he said, it's a difficult job, but I think you can do it. But ultimately, we all need the grace of God, so let's go together and pray. And after we pray, let me flip a coin. And the coin will say, if it's heads, we're definitely going to win. And so the army went and they all prayed together. And the general tossed this coin. And lo and behold, it was heads. You all know that this empowered army, this dynamic army, small but powerful, like all of you fighting the battle of patient safety, fighting the real war against the lack of knowledge towards being more careful in the patient healthcare environments. The army and his general won the war, as I predict all of you will. And then one of the lieutenants at the side said, "Sir, you can always win if you have God on your side." And the general showed the coin that both sides had heads. Either way, he knew that you all would win. So let's all make sure that we go ahead with the attitude that we are going to win this war. God is with us. The good blessings of patience are with us because this is a great way. But ultimately, as I welcome you, let me tell you, I'm very sure that you're going to win this battle. All the best. Good luck to you.
Thank you, ma'am.